As y'all know, I'm a firm believer that not all cures come from the doctor. Use them for your diagnosis, but not necessarily the cure. So I just wanted to shout out a quick supplement that I take on a daily basis. Serrapeptase. I don't know if y'all can see it. Just wanted to give y'all some quick info because it's going to help a lot of y'all. Of course, this information is not to discredit doctors or physicians in any way. I actually see a nurse practitioner. She's aware of everything that I take. She calls me her favorite little hypochondriac. So she's aware and she does know. But you can always ask your doctor or do your research. Serrapeptase derives from a silkworm. It is what they use to actually get out of their cocoon. It is a proteolytic enzyme, basically focusing on breaking up and dissolving protein and excreting it out of the body. What it's looking for is fibrin, clotting, blockages, mucus. People are taking it for scar tissue. Yes, keloids. People are taking it for blocked fallopian tubes as well. Some are taking it just for pain from inflammation. It's also antiviral as well as an antibacterial. A lot of people do use it in conjunction with any antibiotics that they're on because it'll help you cure that infection faster. Its main focus is any non-living protein tissue. Once it's in your system, it does act as an anticoagulant, so you definitely want to be careful if you're on any other type of blood thinners. A lot of people that take it, they end up taking it for one thing and it ends up solving another. That's exactly what happened with me, so I wanted to share that with as many people as possible because it's definitely beneficial. The bottle that I have, it says that it is 240,000 SPUs. SPUs is just serrapeptase units, which is the equivalent of an IU. You want to keep in mind when dealing with IUs and SPUs, you can relate them to your milligrams. However, the way you want to do it is you want to look at 10 milligrams equals 20,000 of these. They say that the max dose per day is 120,000, I believe. I'll be honest with you guys. I am no doctor. However, I'm taking well over that amount. It's not something you can jump into. It can cause you to have a little bit of stomach irritation. A lot of people recommend that you taper yourself up, which is exactly what I did over the course of a week. I worked myself up from taking about maybe 1 or 2 of these a day to literally I'm taking about 12 to 20 per day. It'll stay in your system for about 3 to 4 hours, so you want to make sure that you're taking it, I would say, about 2 to 3 times a day. You always want to take it on an empty stomach. So whether that is 2 hours after eating or about 45 minutes before you eat. It absolutely helps you with if you have any mucus throughout your body, it will dissolve that and help you excrete it. For me, I started taking it for something else, and that's what I noticed that it did. I didn't know how much mucus I had at the end of the day when I went to lay down and go to sleep, but once I started taking this, it's all gone. I don't have that issue anymore. A couple complaints that I've heard about it, the only one that I've heard is some people report that the lining of their esophagus has become thinner. So I take this on a daily basis, but I do give myself about a week or 2 break from it. Then I go right back to taking it as I had before without having to taper up to it. But I will definitely leave a link for you guys. Serrapeptase is an awesome thing. If you have any questions, definitely feel free to comment below. Definitely utilize the link. Have a good day.